I chair the medicine and neuroscience track at Singularity University. So I've been on the founding faculty since it started in 2009, and I founded our program called Exponential Medicine, which looks at how we can rethink and reimagine healthcare through the convergence of all sorts of technologies, from digital health to robotics to big data and beyond. And I think one of the big opportunities in the future of health and medicine is to shift our thinking from the sort of sick care equation where we treat diseases like Alzheimer's after they occur, to picking them up early, even before they have shown up clinically. I like to call that stage 0. And so, for example, only in the last few years, there's some new technologies to image the brain and see signs of those plaques that form 10 or 20 years before the patient would develop clinical symptoms of Alzheimer's. There's even blood-based biomarkers that have been published in the last year or so that are indicative of likely diagnosis later. And companies like NeuroTrack in San Francisco have an eye tracking device that seems to be very specific to picking up eye patterns that will be diagnostic for someone who's going to get something like a dementia later. So with that sort of information, maybe we can start to do proactive brain training and other games, or some of the new drugs that are just coming out, which seem to be able to stop or prevent or reverse plaques from forming. So in the world of neuroscience and neuropathology, there's a lot of opportunity, as well as using some of these tools to better understand and optimize our own cognition. I think, you can make a lot of assumptions, but one thing that's a pretty stable element to look at is the power, for example, of Moore's Law and other exponential technologies. Moore's Law, which was a 50-year-old publication just last month, is how computers are getting faster, cheaper, and smaller, and shrinking to the point where we can wear them on my wrist, like my new Apple Watch, or soon underneath our skin, or in neural implants that are already being used to help patients with everything from Parkinson's to maybe even Alzheimer's. And so I think we can reliably predict that certain technologies are going to get smaller, more connected, more integrated, and that gives us an interesting opportunity to rethink and reimagine how we manage everything from diabetes with small implantable sensors and pumps to psychiatric disorders. Your phone, for example, can be a sensor for a patient who might have bipolar disorder. So in terms of saying we think, maybe, well, it's all a matter of imagination and convergence. And I think because we can reliably predict some of these technology trends, it's up to us to, number one, find the unmet clinical needs and understand them well, design really in a conscious way new solutions, some of which don't exist today but could with the right integration, and come up with new solutions. And one of my favorite, not so new examples anymore is this idea of a medical tricorder. What used to be inspired by science fiction. There's lots of technologies coming together: artificial intelligence, sensors, communication, big data, and 40 companies have entered this competition. One of them, called Scanadu, which was born at our first Future Medicine program, is just shipped 10,000 of these as part of a crowdsourced or crowd-funded trial to look at their Scanadu Scout as one of the competitors in the medical tricorder competition. So I think we can predict pretty reliably that within a few years, the consumer at home will have some version of this that can start to pull in their vital signs. It will be layering in the Internet of Things from their home, sensors in their ceilings, in their cars, in their clothes, and we can use that to be smarter and more continuous and proactive with both our health, diagnostics, and therapy.